Hello everyone, welcome back to my channel. This is Dr. Nancy and today I'm here with a new video. In this video I'll be talking to you about how you should be proceeding with your next 2-month revision plans and how you should be getting that plan of how to do revision and how much times you should do revision plans. I'll be sharing that, so let's get started with the video. So 2 months are left, right? I know this is the time when that anxiety is going to click on, and when so much of self-doubt will be there. Some of us would be wishing that we should just leave, this is not going to happen, we should try next year, I'll prepare again and everything. This happens with everyone, all of us who passed and who are going to pass. Everyone, it's the same, because exam pressure is that way, that we all feel at some time that we can't. But the only thing that keeps us moving is that hope we should not leave, that we are going to will definitely pass, and this time is going to be ours, because we are giving whatever is needed to be given, right? So just don't focus about result right now, give your best and focus on revisions, how much times you can do revision. If your subjects are still not completed, try to complete them. Still take 10 to 15 days and try to complete them. If still some subjects are left, so you can switch to some subjects for rapid revision, because if big subjects you can't go for main videos right now, is not the time. So you should be switching to rapid revision. Here is what I did for my revision plans, how I planned my revision plans. So you can see how I planned my revision plan. This is not like I started with PSM, and I went that way. It's not related to that. It's how much time I took in all my subjects when I started revising for the first time. So I started with the small subjects only. I even did my reading also from small subject, and I choose revision also with small subjects only. But this way, if you are comfortable and you can finish within this time period, so it's very good. If you can take 1-2 extra days, it's okay. If you can finish even fast, it's much better. So it's on you how fastly you are good at revising. Revision, how to revise is also a thing. More of us don't know how to revise. Revision is not you should again go back to the rapid revision videos, you should start seeing the 20-hour videos. That is not how revision is done. You're having the notes, right? Go on notes. First of all, switch your phones, everything, no notification should be coming. Start reading your notes. Stop only at that point, take a pause where you feel that you have forgot the concept. When we'll read, we'll feel that this topic is not remembered or we have forgot that. But when you solve the question, now that everything is going to get applied, trust me, because everything is there in your mind. Just keep reading. When you'll read, you'll come to know this topic. When I read it the first time, I got a problem in this topic for remembering. So you can choose that topic for going slow, and then you can give it a slow reading, and you can go with your revisions. So that is how revision is done, because you have already saw everything and you are seeing it again. So for that, notes are very important. If for some subjects you have not made your notes and you are using the videos for your revision, so just see the videos in 1.5x, but listen the video very carefully. It's not like video you are seeing and you're in your other thoughts, so that way it won't be good. Just focus on the video, whatever they are saying word to word, that should be going in your mind. And then see the video twice, thrice, after every 10 days, 12 days, that way 15 days. So that is a different thing if you are revising with video, because more of us we have habit of revising from video. I also saw videos of some subjects in which, like micro and biochem, I revised it thoroughly with the videos only. Every time I used to see the LRR videos, and I'll be seeing, my revision was LRR videos, so I'll be seeing that videos through at least 4 to 5 times, and that way I took whatever info was there in my mind. It was due to that video. So either it is notes, you should just read the notes, either it is the video part, you should just see the video part. But RR videos seeing again and again is not possible, right? That way one whole subject for entire 1 day is going to go, and sometime even more than 1 day is going to go. So that is one thing. So let's see. Main subject for PSM gynae and surgery for, I have not included medicine, because I always say medicine you can't take 4 days in your hand and you can finish entire medicine. You can, but it's very exhausting. I got a plan from some of my seniors, and I saw some videos, interviews on YouTube, and I came out with a plan that medicine better to complete topic wise than completing in one whole sitting. Like cardio, for I gave 2 days and I finished entire cardio. 2 hour daily, it's enough for cardio. If you have read once nicely, for revision you don't need to go again for the mechanism, right? You know what is the mechanism, so you just have to go with the revision, investigations and treatment. That is the most important thing in medicine. They are not going to ask you the mechanism, why is it happening, how is it going, what is it causing the block and everything. At the end of the day, you should be knowing what is the investigation and what is the treatment. That is the important part of that. So that way, Sian, I used to plan. And medicine, for every time I will say, do topic wise. It will be much easier, it won't be hectic, and you won't feel exhausted with medicine. And for other 3 main subjects, you can take 4 days for each. In 12 days you will be done with your 4 subjects. You can shift your order. It is not in an order that you should be following the same order, but just a glimpse that this much days maximum is needed. In this also, I think gyna for 3 days is enough, because if you will see, I'll talk about prep means ops and gyna. Different videos are there. In gyna, you all would have heard somewhere, and you would be knowing that for FMG, ops part of the gyna is more important. Gyna is more important for NEET PG. More questions will be asked from NEET PG, but in our FMG, ops will be asked more. So focus on ops more. You can take your time, 1.5 day. You can split between gyna and ops, and 1 day you can keep for questions, or else the same day you can keep solving the questions. I think 4 days is enough for all the 4 main subjects. 3 main subjects, and you'll be done in 12 days. After that, psychiatry and radio you can do in 1 day, because it's a small subject, right? It's a small subject and you can be doing it in 1 day. It's not big deal. Psychiatry, as you know, I did it from the RRR videos of Dr. Torios, which came on YouTube. So that is the source which I use. 6-hour video it is, and maximum everything is covered. None of the topics are left. All the important topics, medicine part, everything is there in that. So 6 hours that. And radiology for also, you don't need to go for rapid revision, you don't need to go for main videos. Just the LRR of the radio also is enough, because first of all, very rarely questions will be asked, because in other subject radio will be covered. But if direct question from radiology comes, it's enough that to see that 2-hour LRR video, and that is enough. So you can do this both subjects in 1 day. Apart from that, the other 2 days I've kept for other small subjects. In this micro is there. Micro I've kept it because I did it this way, because micro I did it from LRR. I didn't use the main videos, I didn't use the RR content, because it was not understandable and I couldn't complete the subject. So I did this, but you can take 1 more extra day if you are in that, if you have completed your micro very good way. So you can add your +1 and everything in that. Ortho, forensic, anesthesia and micro. Ortho is also in small subject. You can finish it in half day. In fact, forensic for also I used that 6-hour videos on YouTube. So half day it is going to take, and you are done for the day. Anesthesia is going to take hardly 2 hours, because there is nothing to study in that. You just need to be knowing all the 3 anesthetic drugs, like it should be muscle blockers, and then IV, regional, and that all things only, and their side effects. That is the only thing you need to know. Some cannula, oxygen, and oxygen cylinders, numbering. These are some specific topics which you need to know. I just wrote everything in 2 to 3 pages, and that was all. That was all I used for anesthesia. Micro for, as I already said. So this way 2 days I took for this all 4 subjects, and I proceeded with that. ENT for entire 1 day is necessary according to me, because nose and throat part gets easily, but the ear part is lengthy and it takes time. So whole day we can take the time for ENT, and we can solve the questions and end the day. So that is 1 day for ENT. Biochem and pedia. Biochem also is a small subject. It's not so much big subject. Even if you have a notes also, you can revise it from your notes. Pedia also is a small subject. So 1 day I kept for these both. Anatomy for I gave 1 entire day, because anatomy I didn't complete it. So I took whatever videos of Azam sir was there on YouTube, I saw them all. So entire 1 whole day anatomy for I kept. But if you are having anatomy notes of Azam sir, still you can go with the notes, and I think anatomy for 1 whole day is necessary, because a lot of data is there. Pharma for also same, 1 whole day is going to get. Patho for also 1 whole day is necessary. Optha 1 whole day. Apart from that, physio and derma, why have I gave 1 day? Because physio I didn't complete it with the whole RR PAP also, and I didn't complete it with physio also. I gave a reading before, I completed it with marrow, but after that I was not having the video access again, and notes were there, but like after 2 years I was reading my notes, so I was not able to understand anything. So I just switched to YouTube, and whatever videos were there according to that. And one thing is there, how much also physio you read, questions will get wrong of physio, I don't know why. So that way I plan it in just one day. But if you are good with your physio and you have a proper notes, take your time, take one more day, one entire day for physio, and then you can plan that way. Dharma for half day, one day is enough, because it's also kind of a small short subject only, hardly 5 to 6 question comes from that. And medicines, as I said, every day one topic in 2 days. That way you can go and you finish. So if you'll count this entirely, means 1 plus 1 2 3 4 5 6 plus 1 7 8 9 10 22 days. So it's around 22 days. If you'll still give 1-2 days extra in your preparation, around 25 days you are done with your proper first revision. First revision in 25 days is going to get completed. After 25 days you are supposed to give a GT. If you have not given in the entire month, if you can wish, give after 15 days when you finish your main subjects and some additional small subject, give one GT, and then again give one after finishing the GT. So you can come to know by your revision, did everything come in your mind or not. So that is one thing. And so this way you can go with your first revision, and your first revision will be done. This was a plan about like first revision, how you should be doing, because first revision it's not like you have to skip only everything, but everything is to be remembered, but in a fast way. So that is one thing. I followed this was my time limit, how I gave for the subjects, but time is on you, how you want. If you are a fast reader, you can finish it even before. If you are a slow reader, you can take 1-2 days extra in your hand. So that will be all, and plan your revision in a good way so that you can finish before 1 month ending. Still some days are there in your hand. Don't miss out on the question solving part. Question solving is an important part right now. Don't let the anxiety get you. Anxiety is normal right now, but you should not be taking it in a bad way. Take it in a positive way, and our mind works better in stress. So let's make our mind work better in stress, and give your best. Revise as many times as you can. If you are feeling that the subject of mine is weak right now, or I didn't read it right now time is not there that you can again go back and you can study it. Obviously time is not there. So you can go with your rapid revision. If still rapid revision of that subject is big, you can go on YouTube videos. If still it is not there, you can just do is that you can solve all the PYQs of that questions, and you can be all the previous year topics you can go and you can see. That is the least you should be doing, so that you should not leave an entire subject blank. Okay, so focus on these things and prepare well. And if any kind of doubts, you can always I'm always there on Instagram and even on YouTube. So you can always text me, and that will be all. Prepare well. I'll see you in the next video.